Hello. How are you? Welcome. If you're live with me, drop in the chat where you're coming in from. And I'm so grateful to be with you today and jump back into the online live doc show and just share ways to actually support you naturally, right? So, February, for most of you, realize it's cardiovascular month, heart health month. Um, and we have a high prevalence of heart disease, which I'll go through with each of you. But I want to ask you right off the bat, like, first of all, how is everybody doing before I get started? Like, drop in the chat, like, how things are going for you, where you're at on your health journey. And because my gift and my goal is to show up with you as a naturopathic doctor to support you in your wellness journey, right? So I help you as a leader. You're a leader because you are in charge of your life. And I help leaders anti-age get their blood sugar in check and have amazing energy to be able to do what God put you on this earth to do. And that is my goal. Because the truth is, every single day I get a phone call that somebody's been diagnosed with cancer, or we have heart disease, or we have plaquing, or the emergency room is packed with heart circulatory conditions and cold hands, cold feet, could be headaches. People are experiencing high blood pressures. Like, this is like the Heart Association, it's just so massive, cardiovascular health. And so, as you know, my goal is to step in and support each and every one of you on this journey. So, again, if you're coming in live with me, please let me know where you're coming in for. I'm so grateful to have you here because the truth is like, you never get this minute back, right? Today is the day that you get to focus on your health. And there's so many individuals out there that are suffering with their chronic health disease and they just ignore it. And I want to ask you, are you somebody that's actually ignoring your health right now? Are you really stepping in and try to create change? Because there's so many different balls that we're moving around when you're trying to make change in your health. And so I show up a few times a week to support you with that. So let's step into heart health, right? We've got Valentine's Day on Wednesday, which I call a Hallmark holiday, but the truth is the American Heart Association really amps up February for like looking at your cardiovascular health. Like, your heart is your major organ. It's what like pumps circulation throughout your body. It brings nutrients, it brings amino acids, it brings everything that every single cell needs, goes through your cardiovascular system. And your heart is like a pumping mechanism, right? So as it pumps, it brings circulation around, and then what your body doesn't need, then the lymph brings it back up through the lungs, through the circulatory system. We oxygenate, deoxygenate blood, we bring oxygen through the bodies. And, I want to step into this today for many various reasons, but like, we have so much going on with low oxygen. So I just have so much coming through me when I start talking about this. So be patient with me to like stay on track and stay organized for you that are really like focused, detailed people. When I start talking about a subject, I sometimes go off on a tangent because I feel very strong about you getting your health in check. And that's why I show up. And that's why I take time out of my schedule to support each and every one of you, because our healthcare system, we're just in such a sick care system in the US. And I believe that we're trying to do the best we can. I like to believe that because um, I hope that we're not causing damage. But the more that you get to learn about yourself and the more that you get to advocate for yourself, the truth is that you'll get healthy. One of the things that patients comes into me on when I talk about changing nutrition, which we'll talk about today, is that they'll say to me, I just can't do it. It's too hard. Really? Is your health important to you? Like, you just can't do it, it's too hard? Are you waiting for a chronic disease? Are you waiting for a cancer diagnosis, a diabetes diagnosis? Are you waiting until you have to have surgery? I don't know what it is, but your health is right now. And it's so, so important for you. It's so important for you to step in and take responsibility because you're going to take responsibility of putting food on the table. You're going to take responsibility for paying your bills, living in a home, taking care of your children, being a husband, being a wife. I don't know what that is, but you can't do any of that if you don't have your health, right? So that's why I'm so passionate about this. And that's why I stepped into this years ago. For those of you that know my journey, I have talked about it. And this is why I am so passionate. So let's dive into a few statistics around heart disease so that it can it's not to scare you. I don't do that type of tactic, but it's for you to really become aware of what's happening around you. Like, how many of you have heard somebody like just going into the hospital and not coming out, or you get a phone call that somebody's no longer with you and it was a heart attacks are happening 1 in 5 right now. That's where the statistics is running when I pulled it up, because I always pull it up right before the show. Like, what are the statistics? And it's like, it's about 700,000 people in the US are dying from heart disease, and we can change that. It's the leading cause of death in men, women, and people of racial and ethnic groups across the United States. One person dies every 33 seconds from cardiovascular disease. Scary, right? If that makes you nervous, like, drop in the chat heart, because our heart is our asset for our life. It is the leading cause of death worldwide, with millions of people being affected. Not only is the patient being affected, but all the loved ones involved in that patient are getting affected. And it's really like, I wanted to look at what is diagnosed to undiagnosed cases. And that's really challenging because we don't know the numbers of undiagnosed cases. Why? We only know the numbers that are coming into the doctor's offices where we're taking statistics, or they're coming into the hospital, right? So that's how we know what the statistics are. So there could be a significant number of people that have undiagnosed heart conditions. And this is so important. This is why I say to so many of you, be sure to get I like to do it every 3 months if you're in a scare right now, meaning, like, do you have elevated cholesterol? Do you have high blood pressure? Are you feeling your heart like it's palpitating? Have you gone through grief? Like, I don't know what it is for you, but that's why I say, like, get your test done every 3 months so that we can track you. I know that is not how they're trained in the medical world, and that's fine, but at least get it done like every 6 months if you can do that, so that you know where you're at. And there's so many different tests out there for cardiovascular disease. For those of you that want to know, like, specialty, if you pick up Tony Robbins' Life Force, I'll drop it in the chat. He through COVID went out and interviewed so many practitioners about ways and different testing that we can actually have done in order to know where we're at, that tells us sooner rather than later. So I suggest that you pick up his book, because I'm not going to go into detailed testing, but I want you to know, like, you get to advocate for yourself, right? And I know it's hard. I'm advocating for my mom right now. She's got leg pain. It's definitely circulatory. We're trying to figure it out. And I had to step in. I don't believe in treating my family, but I've had to step in because she's in so much pain and they're not getting the test done. So finally, after 3 months, we're getting the ball rolling because we've had people on our side. So let's get back to what I really want to talk about today. So, we are living in a sugar world. There's no lies around that. This isn't surprising. I'm talking about blood sugar all over the place. And believe it or not, prediabetes and diabetes is a significant risk factor for heart disease. So individuals with diabetes and, sugar challenges have a high risk of developing cardiovascular complications. So if you have prediabetes, diabetes, well, let's talk about diabetes. The American Heart Association is statistically saying that those diabetic patients are 2 to 4 times more likely to die from heart disease than those without diabetes. And remember, high cholesterol, it's a sugar problem. We've gone over that. Like when I get patients off of sugar and starches and I focus on healthy fats and quality protein and vegetables, we're able, unless it's genetic, because there are genetics out there. So keep that in mind. I'm not treating, I'm not diagnosing, I'm merely sharing information that cholesterol can often be brought down when you pull back sugar and you exercise. We're going to talk about lifestyle, but the International Diabetes Federation back in 2020, approximately 463 million people are living with diabetes globally. And they are projecting that by 2045, not many of us, we will be here for this, is going to be 700 million if we don't turn this around. So diabetes is just right now they're saying 34.2 million in the US have diabetes, and I believe that was 2019. I couldn't find anything closer right now, but and then 88 million are struggling with prediabetes. So that is developing a risk for heart disease. So why do I want to talk about heart disease connection and prevention? Because first of all, we're in Heart Health Month. And second of all, our heart is so important. We go through grief. We've been through a difficult, people say 4 years, 5 years. It's just been a journey with so much that we're seeing in this world and so much that's televised. And I want you that are on this live with me or listen to the replay, I want you to take back your health, because you can do that, but you just need the right practitioner on your side to actually take your health back, right? So you get to start advocating for yourself. And you know where to find me if you have any questions. I'll drop it in at the end of the event. For those of you that are live with me, please drop in any questions as I go along and I will answer them at the end. So if you have diabetes, of course you have a higher risk for blood pressure. Of course you have a higher risk for high cholesterol, just like I talked about. And that further will contribute you to heart disease. So we're going to talk about heart healthy diet. We're going to talk about exercise. We're going to talk about diabetes management. These all play a crucial role to inhibit the complications of heart disease. I will tell you, every single day in my clinic, I'm dealing with somebody that has some sort of heart condition. Again, it can be high blood pressure, it can be high cholesterol, it can be heart murmurs, it can be heart racing, it can be anxiety, which sets off you're feeling that like movement in your heart, or people coming in, they're like, I just feel my heart. So there are so many individuals that are suffering right now. So what I want to talk about is some of the factors that actually start you down on a heart disease diagnosis. So we are definitely looking at genetics, because that is one piece. I'm not talking about that today, but I do genetic testing with patients. But we're looking at your age, your gender, and quite honestly, your lifestyle choices. So you can have anything from like left shoulder pain to chest pain to headaches to coldness in your hands and feet. Could be a circulatory issue. And the quicker that we encourage intervention and early detection, the quicker that we can actually heal. When I think of that, what is the best reversal? It's the Mediterranean diet with low sugar and starches. And I'm saying there's other nutrition plans out there, and I want you to think about it as not a diet. I want you to think about it as a lifestyle plan. Like I tell patients, I create customized treatment plans for them. I tell them we create a blueprint for them. We create what their vision for health gets to be. Those of you that are on, I am running a summit tomorrow, the Vision for Health Summit. I will drop it in the chat. It's, you know, you get to create what is so important for you around your health. So when we look at diet and nutrition, there's a summit link for those of you that want to join. I'd be happy to have you. I'm so excited about it. But when we're thinking of nutrition, the first thing that I want to talk about is the Mediterranean diet is what's studied, is what's researched, and has the best healing for cardiovascular disease. And you're like, okay, well, what does that include? And it includes whole health foods, right? And the diet itself is going to be rich in fruits and vegetables, whole grains, proteins, and healthy fats. And so when I mean whole grains, I don't mean white rices. I don't mean white pastas. Like, I mean like barley and quinoa and kamut and spelt, like really good quality grains. And if you can do wheat, like whole wheat or rye, like we want quality grains. I don't want like bread that's from the grocery store that has no value in it. And, you know, start to read your labels. The other piece that's in there is olive oils and fish oils. You don't ever, that's the healthy fats. You don't ever want to cook your olive oil because you break it down and then you take away the great quality of it. You can even do quality fish oils. Like I use integrative therapeutics, or I've used research nutritionals. You got to be careful of the quality fish oils, but we have to get omega-3 from the outside world. Where do we get it? We get it in nuts, specifically walnuts. We also get it in fatty fishes like salmons and halibuts. And, you can get it in sardines. I personally don't like sardines, but I have a lot of patients that love it. So chia seeds is another place where it's rich in omega-3 fatty acids for your heart health. So think about like when I go to the grocery store, and this is like a general nutrition plan, but specifically Mediterranean for heart disease or reversal, just because we know it's researched and studied. What is my vegetable? What is my protein? And what is my healthy fat? That's going to get you out of the sugar cycle, right? And like if you're really in the sugar cycle, there's probably times when you get irritability, you get hangry is what I called it, you get agitated, you get anxious, and that's probably your blood sugar dropping, which is not good for heart disease because your body wants to be balanced, right? So when you're eating a heart healthy diet like we just talked about, you're looking at anti-inflammatory foods. That's what they are. And anti-inflammatory foods are low sugary foods because as a physician, as a doctor, I'm sorry, we're exploring the connection between inflammation and heart disease. So if you eat whole foods like we talked about, that is an anti-inflammatory diet because so many patients come to me and they're like, Dr. Donahue, like everyone's like, get on an anti-inflammatory diet. Like my gut's bothering me. I have SIBO, I have gut issues, I have high blood pressure. What's an anti-inflammatory diet? That's what it is. It is a low sugar diet. And it is like geared towards foods that are quality for your body, for your health, that have low acid. So let's talk about the heart needs to pump, right? We talked about it pumping. We talked about it bringing, you know, nutrients, and we talked about it bringing oxygen out to all the tissues. And then the venous system, the veins bring deoxygenated blood back to the heart, and we oxygenate it. So one of the things that keeps your heart muscles strong, because your body's biggest organ is your muscle, right? It's not your skin, it's your muscle. Your heart is a muscle. So to keep the heart strong, you don't get to sit around and do nothing. I don't know those of you that have watched the Blue Zone, the Centurions, but they, even when they no longer stay in their career, they find fun ways to play pickleball or to get outside or walk or hike. So regular exercise on the heart keeps your heart healthy because what it does is the aerobic exercise gets your heart rate up, right? Like in the breathing. And I don't want you to have shortness of breath like you're going to pass out, but aerobic exercise creates a sweat, strengthens the heart, pumps the cardiovascular system. And so that is so good for the heart. And the more you put the strain on your heart, the higher, the more fit you become, right? You cannot sit around and think that you're going to get your heart healthy. And as you age, your muscle tone gets weaker. I mean, how many times have you looked at yourself in the mirror and you're just like, my face feels bloated and swollen, my arms feel swollen, the triceps aren't built out like I want it, like when I was younger. That's why it's important to strength train. It helps keep your body strong, especially your core. And it supports the heart. It supports your heart health, because what did I just say? Your muscle is your biggest organ. Your heart is your muscle. And the more you pump it consistently, you're going to find a form of exercise that you really like. And that's how you maintain consistency. Let me know in the chat if you're getting this. Type in yes, like I get it. Like the heart is a muscle. So when people are like, I don't want to exercise, I don't feel like exercising, or one of the first lifestyle things people give away is exercise. Why? Like that's what we're meant to do. Like my dad grew up on a farm. He doesn't like to exercise, but boy, he probably worked harder than I did when I work out every day. From like haying to milking the cows to climbing the trees, to picking apples. Like I don't care what you do for cardiovascular health. You just need to really move your body. So important. The other pieces that I want to talk about are away from the physical piece, because I talk about the physical piece so much. I really want to talk about the emotional well-being of your heart. And that's Wednesday. And you may or may not like Hallmark holiday Valentine's Day, but what you could do is love yourself this Valentine's Day. Have love and positivity in your heart. Explore how you feel when you feel happy and you feel joyful and you feel like your heart is full, or you see something beautiful and it brings joy to you, as opposed to the opposite, because life is all about polar opposites, right? Stress management. I don't believe that we know how much stress affects our heart. So you want to step into more love, more connected. And the other thing that I just want to quietly get with all of you here is that so many of us are looking for external forces for our emotional well-being. We look for somebody to give us a compliment. We look to be loved. How about if we just love ourselves first? Wouldn't that be awesome? Like you look in the mirror, like, I don't know those of you that may know Mel Robbins, but she looks in the mirror, gives herself a high five and says something positive. Think about how can you speak positive to yourself. One of the things that I do every day is I put my right hand on my heart, my left hand on my lower sacral area, and I ask myself, what do I need today for my emotional well-being? It's kind of like we pick out our clothes to wear. Why not we choose how we want to be today? Right? How do we want love? Do we want joy? Like, what does that get to look like? And what's going to trip us up? And be aware of that so that we're ready. Because stress can be so overpowering, especially when we see so many people going through such tough times. With me going into detail, the stress can be overwhelming, but we get to change our energy in our body. We get to create joy, and we all go through difficult times. I get it, right? So what I think of with stress management is getting inside of your body, like taking some deep breaths. Is it prayer? Do you meditate and quiet your mind and you're like, but Dr. Donahue, I don't know how to quiet my mind. My mind just races. I get it. But meditation isn't a perfect practice. You're not supposed to be able to shut your mind off. So those that tell you to shut your mind off and that it's possible, I'm sorry, it's just not. But being aware, being mindful of what's happening around you. Like one of my words for this year is limitless, but it's also being present. When I choose to do something or be with somebody, be present with them and hear them. Um, the other piece is deep breathing. Really take a deep breath in. You can even hold it or breathe out. There's many people out there that are touting fast breathing. There's all different ways. So figure out what works for you and integrate that into your daily life. All these pieces I'm talking about, if you're not doing any of them, like nothing that we talk about today, you're not doing any of them, I'd ask you to pick a maximum of 2 that you can start implementing right away. Over the years, I've changed my routine. Like this year, I added journaling, and it's been tough for me to journal morning and night. I admit it, right? I have the other pieces down. I got food prep down. I got exercise down. I got emotional awareness down. I have so many pieces down, but I know journaling is going to take me to the next level when I move through that. I know how good it's been for me. If you have like some sort of like depression or anxiety or something that's affecting mental health, this could affect your heart health. So I would encourage you to get support if this is you. Don't wait until it gets so big that you can't actually care for it. And it's okay to ask for help. This thing about I can't go to therapy or I can't ask for help or I can't afford it. Like I don't know what that excuse is. I call them excuses, but you better start taking care of yourself because life is right now. Like, it's right now. I'm in pain, like, oftentimes, I'll be honest with you, I get in my car and I cry on my way home because and then I have to change my state because people's illnesses are just so much more complex than they were when I started practicing, like, oh gosh, how long have I been practicing? 17, 18 years ago, and then personally, I've been practicing on myself for 30 years. So let's step into the next piece I want to talk about, self-love and forgiveness. Emphasizing how like self-love is so important. I talked about that a little bit a few moments ago about going inside of your internal self and forgiving yourself and reducing stress. And God forbid, if somebody's in your life causing you stress, figure out how to change it. You get to advocate for your health. How can you forgive to open your heart and support your mental and cardiovascular health? We all have patterns and paradigms and beliefs that we've carried. But sure as heck, please learn how to forgive. It's hard. I know it. I'm with you. I get challenged most times, but ask for help, whoever your higher being is. Like, really step into asking for help around that. So, let's sum up so far what we've talked about. We've talked about exercise. We've talked about let's stop. We've talked about understanding your heart disease. What does it look like? What are some symptoms? We've also talked about statistics, not to scare you, but just so that we know, like, that you're aware of what's going on out there if this is you. We've talked about the Mediterranean diet, whole fresh foods. If it doesn't come from our earth, don't eat it. If you can't read the label and you don't know what the item is on the label, probably not going to digest it. A Mediterranean diet is what's studied and researched in cardiovascular health. We talked about anti-inflammatory foods. That's really cutting back starches and sugars and then getting in healthy fats and healthy vegetables for anti-inflammatory. We talked about exercise. I don't care what type of exercise you do, but you want to do exercise that works for you because the importance of it is the consistency. Like, find an enjoyable form of exercise and maintain that consistent routine. Then we talked about emotional well-being and stress management, and then self-love and forgiveness. So now I want to go down more back into the physical piece. So many individuals struggle with high cholesterol. They struggle with total cholesterol being high. HDL, which is your good cholesterol, being low, and LDL, which is not your friendly cholesterol, being elevated. And also, I can see elevated triglycerides as well, oftentimes in heart disease and cholesterol. So, those, having a lipid panel slash cholesterol panel, we call it a lipid panel in the medical world, um, so that you know where you're at. Ask for your sugars to be done fasting. Ask for hemoglobin A1C. Your sugar and your hemoglobin A1C is the beginning markers if you have a sugar problem or if you have prediabetes or diabetes, right? And all these inflammatory, sugary, acid foods over and over again are not good for our body. And if we end up on the extreme side, past cardiovascular disease, what's the next worst disease? Does anybody know? Past cardiovascular disease? Drop it in the chat if you're with me. No? I'll answer it. Cancer. The C word. How many people have been touched with cancer in their life? From family members to loved ones to friends to coworkers. I don't know what it is, but it's so massive right now, and we're not doing a good job in really, talking about how important lifestyle is. I mean, many of us are, but this is why I'm passionate to healing chronic disease and showing up with my time to support you guys. So, you really want to watch your cholesterol levels. Again, it's a sugar problem, right? And when you have too much sugar, it can't stay in your bloodstream. So you start, the sugar will go to the muscle, and it'll say, "Hey, do you need some sugar?" And the muscle's like, "No, I got enough." And then it's like, "Okay, I got to get out of the blood. Where do I go?" Well, it starts storing it as fat, right? And then you're like, why do I have all this fat on me? And then when I take people off sugar and starches, they're just like, "Oh my gosh, I'm not carrying this heavy load, or I lost 15 pounds." The truth is we're getting the metabolism in better check. I mean, there's a lot more to it. I'm just really summarizing for you not to confuse you. But reducing sugars, reducing saturated fats and trans fats, that's another way to bring down cholesterol levels. And also, if you have a lot of sugar in your bloodstream, burn them up by exercising. Don't sit around and think that a pill is going to take care of it, because your health is right now. How many get that? How many really, really, truly, honestly get that? So many people in my world will come to me and say, "Dr. Donahue, you're my last resort." I'm like, "Okay, let's figure this out. Let's dig deep. Let's figure out what's going on. Let's create a plan." My patients stay in contact with me. I 100% get phone calls from them. I don't charge for phone calls, because the truth is it is challenging to change a lifestyle. Like, if you're 30, if you're 40, or if you're 50, you've been doing it this long for so long until you get a cardiovascular event or until you get a diagnosis and it scares you. How many people have been scared? Right? I mean, I remember when I was on my journey back when I was a teenager and I was severely depressed and I was scared. All my friends were having fun, but I was committed to figuring this out. And that's why I love what I do. I'm committed to healing chronic disease as much as I can. And that's why I'm in the online space. So, lastly, I want to encourage you to have your regular checkups. Get comprehensive lab tests. Get your cholesterol levels done. Get your sugar levels done. Ask for homocysteine. Ask for highly sensitive CRP. And track your progress. Because we know in our world, whatever we track is what changes. I admit it's hard to track your food every day, but you get to do it, because that's what will change. If you start to look at the numbers, like, I have a desire, I have a goal right in front of me for quarter 1, for my health, for all of you, for showing up for you on online live doc shows, for doing summits for you. Like, I have goals and I am going to hit those. And for you, have your health goals. Is there something that you want to happen? Do you know, I think, is it a $50 billion industry, the diet industry is? Why? Why are we spending money on quick fixes? Healthy, amazing bodies are built in the kitchen. You can't out exercise a quality, healthy diet. And you need to get your protein in. Like whatever say your ideal body weight, let's just grab a number, is 150 pounds. You should be eating 150 grams of protein. And then maybe 50 to 75 grams in fat and the rest in carbohydrates. In our country, we are like so not on the protein scale. We're not eating enough protein because as you age, your muscle needs protein. As you age, if you don't give your body and your muscles protein, your body starts to break it down. You get into this, what we call a catabolic or a breakdown state. I don't know about you, but when I turn 80, I want to be able to sit down and stand up. That's why I lift weights. That's why I work out. That's why I eat the protein that I eat. Like you get to do that for yourself as well. Look at what your ideal body weight is. And yes, it's about calories in and calories out, but it's so much more than that. It's about hormones. It's about sugars. It's about fats. It's finding something that works for you. Because in my clinic, there's no two nutrition plans that are the same. Literally, there's no two nutrition plans the same at all, at all, at all. So that's why we talk about customized treatment plans, right? We get to figure out what works for each and every one of us. So as you monitor and track, this is how you get to make the adjustments in your lifestyle. Ask your practitioners for help if I'm not supporting you at like coaching around your health and your nutrition. Because as you address these comprehensive aspects of heart health that we talked about today, you can start to adopt a natural approach to healing and create a healthy heart. And this is not a medical claim. So please don't say I said that you can turn this around, but heart healthy and embracing a lifestyle that promotes overall well-being for your heart. So what did I call this live? Healing the heart, how the best diet and lifestyle change can reverse heart disease. That's what's important right now. So those of you that are on, if you have any questions, drop a heart or drop a question. And I'll wait a few more minutes to answer any questions before my 11:45 call in about 10 minutes. If you have questions, don't be shy. I am here to answer them. I see quite a few of you on live right now. And how many of you need accountability? How many of you would just like crave to get into my voice and like hear me talk and connect with you? Because we also know, even for myself, I have my whole team of practitioners. I have a massage therapist that's more than a massage therapist. I have a physical therapist. I have an acupuncturist. I have a naturopath on my team, and I have a chiropractor. I practice what I preach. And then we pull labs on me every 3 to 6 months. Sometimes 6 months goes faster, but I know where I'm at and I know when I'm not feeling like myself because I'm connected to my internal way of being. How many of you can say that? How many of you could really like step into the truth of who they are and you know how you feel and you know you're doing the absolute best you can every day? Some days I'm not doing the best I can. I'm just like you. But now, because I've practiced it, I can flip my mindset, I can flip my lifestyle, and you don't have to wait 60 days, 90 days and beat yourself up that you're not eating the right nutrition plan for yourself, because the truth is the next meal you can get on track. You know what I didn't talk about is water. Water is so important for cardiovascular health for all your cells. Half of your body weight in ounces of water, quality filtered water. Okay, well, I don't see any questions coming through. I have the summit that I'm running tomorrow. I'm super excited about it. I'm having amazing guest speakers. We have speakers talking about $1 million body. We have speakers talking about mindset and emotional intelligence. hypnotherapy and getting into the internal way of being. I dropped it in the chat here. Please sign up and show up and ask questions, because this is my gift to you. The speakers are not getting paid. They're showing up because they're on the same path and journey, and they're as obsessed to getting healing, because all of this mindset stuff and this negativity that we talk to ourselves, it eats on us after a while. And, the world isn't really a very happy, positive place. We get to hang around individuals that bring that positivity through. So we're going to hear from even a mental health therapist is going to talk about different ways to heal, your, maybe it's anxiety, depression. I'm not sure exactly what she's talking about, but I've met each and every one of these speakers, and I'm super, super excited to be hosted with them. So that's the simplehealthnh.com Vision for Health Summit that starts tomorrow at 12 p.m. Eastern Standard Time. If you're feeling like you really want support in what I'm doing, I'm going to drop, and you want to be held accountable, and you want to be with other like-minded individuals who are stepping into what they're doing every single day, click on the link, join Pocket Doc. You got me in your pocket. How many would you like to have me in my pocket and show up with me once a month live? Because the truth is, guess what? Our next live is coming up on February 14th at 1 p.m. Eastern Standard Time. It just happens to fall on Valentine's Day, so I get to wish all of my beautiful peeps in that program a happy Valentine's Day, where I teach on a subject, and then I show up and I support them, and they get to ask questions so that they continue to advocate for themselves. So I'm sending you all so much love and so much blessings. You matter. Your heart matters. And I can't wait to see you for the next online live. Have a blessed, blessed, loving month, and just really love on yourself. Just love on yourself and know what your labs are so that you can heal. All right. Mwah! So much love to you guys.